what we have now is a new molecule. This is something which all of us as Indians know extremely well. And it has been used in our traditional medicine systems for generations. What we have found is that this might make some difference to the inflammatory chain which we were just discussing. So this is the Mr. India which might kill that mogambo. All right? It's called curcumin, but it's none other than the yellow powder, turmeric, which we use in our food day in and day out. There have been a few studies across the world with this. What that does is essentially it attacks that NF-κB inhibitor. What evidence do we have that it works? It has been around for maybe a few years. They have compared in a cohort of patients this usage of this compound with diclofenac and found that it does affect pain to quite a similar effect as diclofenac does. Now, this was in a cohort of patients in a particular region with a fairly large dose. I mean, we don't know what is the best dose and what is effective, but that was 500 milligrams per day. And we did see that that does give decreased inflammation. Not only that, there were other pilot studies. You've got smaller groups of patients here. It was tolerated well. With a comparable dose of diclofenac, you would probably get a lot more gastro or GI burning, which you didn't seem to get with this. Then there were other people who, forget about diclofenac, just compared just what happens to patients with use of curcumin, and at least half the patients said they felt better. So it's something which might be promising. Further on, people went and compared that with ibuprofen and found that there was a significant and comparable decrease in pain scores and increase in stiffness and activity levels, pretty much like ibuprofen without the side effects of ibuprofen. So I would think it is something similar to this. If you have this as an ingredient, the film will probably work. So maybe, similarly, if you have curcumin, it would probably help arthritis with less side effects or less dangers. What next? Similar, more studies, 100 patients treated for 8 months. It did seem to make a difference with decreased side effects. And then what they did was, they tried combinations. So curcumin alone was known to help, you can say, comparable to ibuprofen or comparable to diclofenac. Why not combine curcumin with diclofenac? So if one of them works, the other one, which is also known to be good, if both of them are together, it is sure shot to be a hit. It's that sort of principle at the end of the day. And it seems to work. Similarly, it works in combination with other drugs like celecoxib, steroids, and even methotrexate. So all those combinations work. And it probably has been proved with those studies. What we don't know is that whether this has been proved on a very high scientific level. We know it works, we feel it works, and it might be something which is safe. But if you have to just critically look at, we as scientists, I think we need to sit together and look back at these studies. And what comes out is that they are essentially cohort studies. So the evidence is not one of a high standard randomized controlled trial, which will probably prove its effect beyond doubt. But what we have here is essentially level 3 evidence. So I suppose it is worthwhile in the sense that we haven't seen people dying with it or having serious complications like many drugs tried on guinea pigs had. So is it enough to say that we should prescribe it for our patients? That is for you to decide and for us to talk over dinner. Safety is one thing which is probably more important before you start prescribing a drug, and it seems pretty reasonable with this. All the drugs out there, I remember very little of my pharmacology, but any drug, if in the Viva I was asked about side effects, I would say nausea, vomiting, diarrhea. And I suppose that applies to curcumin as well. But thankfully there isn't much more of that to remember in this. Conventional curcumin, however, is not proved to be reaching the beyond the intestine. So we might be consuming a lot of haldi. If that were the case, Indians would not get arthritis, because the amount of haldi in our diets, if it was reaching our joints and reaching our blood, we would not get arthritis. So the question is, how do you actually make it reach? So things like that are not going to actually prevent arthritis. The effect, of course, is delivering it to the right place. We know the Sanjeevani is there on that mountain, but it is, do we have somebody to carry it and take it to where it is required? And if it reaches the blood, if it reaches that NFKB, that will probably work there. But it is a question of whether those doses like 8 grams and 2 grams plus per day are realistic, and whether those in the long term will give rise to side effects. And this is what we as scientists need to evaluate. This is probably what we need to involve this innovative company in and do a phase 3 or a further phase 4 trial when this drug comes out. What they do have at the minute is a technology which makes it more absorbable by the GI tract. So what it is microemulsifying, self-microemulsifying drug delivery system which helps it cross the intestinal barrier. Whether this actually makes a difference is yet to be seen. However, what we have out there is only a human pharmacokinetic study which has actually shown a little better bioavailability. What we need to aim for with usage of new things and newer treatments is to integrate our patients into a life free of disability. To celebrate World Arthritis Day, because I'm treating hip and knee only, this is what I organized in Mangalore last time. This was just last Sunday to celebrate World Arthritis Day, which was earlier in October. And we have a group of patients who've been treated by us over the last year. We invited a lot more, but those are them. And a lot of them have had knee replacements, of course, but there are others who've been treated with disease-modifying drugs. There are others who've been treated with injections. What we wanted to show is that with the right and proper treatment, patients can actually, and our aim should be, to integrate them back to a normal life. It is not necessary that for them to be normal at whatever stage that they should have an operation. It is what that patient desires. And the definition of normal, what is normal for me, may not be normal for my grandmother. So it is what they require. It is what individual disability they have. We have a wide variety of treatments available. It is up to evaluate, it is up to us to evaluate that for the individual patient and make them better. Thank you.